Dr. Samet, a pulmonary physician and epidemiologist, is Dean of the Colorado School of Public Health. And for several decades, he has been involved in global health, focusing on tobacco control, air pollution, and chronic disease prevention. Dr. Samet has served and chaired numerous committees of the National Research Council and the Institute of Medicine, and as the chair of the Clean Air Scientific Advisory Committee of the US EPA and the FDA's Tobacco Products Scientific Advisory Committee. Dr. Samet has served as editor and author for reports of the Surgeon General on smoking and health since 1984, receiving the Surgeon General's medallion in 1990 and 2006 for these contributions. Well, personally, Dr. Samet was my chair when I was a graduate student at Johns Hopkins Bloomberg School of Public Health. Let's welcome Dr. Samet, and he will be sharing with us the growing importance of evidence synthesis in public health. Over to you, Dr. Samet.
Thanks so much, Tenjing. And as mentioned, I'm going to supply some historical and practical background about happenings in around evidence review, synthesis, and integration in the world of policy that I often live in. So I first want to start by saying welcome to the Colorado Evidence Synthesis Program. I'm delighted that over the last year, both Tenjing and Lisa have joined the faculty on our campus, complementing a host of existing activities. And of course, pleased that the Agency for Healthcare Research and Quality is sponsoring this symposium that's been organized by our folks on our campus and elsewhere. So I want to start with a historical note. For those of us in pulmonary medicine and epidemiology, Archie Cochran, in fact, was one of the very early respiratory epidemiologists. He was part of a groundbreaking unit that studied lung diseases in Cardiff, a unit of the Medical Research Council. He was interested in information quality. This is a 1951 paper on observer errors in taking medical histories. I had the opportunity to meet Cochran in 1977 when I presented one of my first research studies shown over here. I just looked up, it's been quoted 38 times since its publication in 1978. There was in fact a redo of his 1951 study, and I'm pleased that I actually had the opportunity to meet him. And of course, he went on during his career to do many pioneering things. So in terms of what I want to talk about, I want to set out this general framework for going from research to regulation or other action. This comes from an article that I wrote with my Hopkins colleague, Tom Burke, and deregulation by the Trump administration over its 4 years, and how every element of this schema, going from research to regulation, was under threat, and in fact, efforts to deregulate were carefully tracked. But looking at where systematic review sits, it is in this critical step between moving from what we find in research studies to integrating evidence to come to important conclusions, typically about whether there's a hazard, what the dose-response relationships may be, and looking at patterns of exposure, and then using this information in policy analyses. So the steps we're talking about sit up here. In this world, uncertainty is often critical in decision-making, and there are various tools, of course, to quantify it. And uncertainty comes from ignorance, and very often our discussions are about what we know are clouded by doubt and sometimes artificially created. So here are those terms once more, and a wonderful pair of books by Firestein, a neuroscientist at Columbia, who teaches a course on ignorance to undergraduates. So I want to turn back to tobacco and talk about how evidence matters. and some of the starts at putting evidence together to reach conclusions. One landmark was the 1964 Surgeon General's report, the first time, to my knowledge, that the US government went on record saying that something was bad for health. In this case, of course, it was cigarette smoking, the finding that smoking caused lung cancer in men, not in women at the time because the evidence was so scant. In looking back at this report, to me, it comprised a very early example of a systematic review. There was a large team that did the report. They had a plan. They judged the quality of the information, ranging from the individual studies to the interpretation of the evidence. And of course, they put in place a set of criteria for data integration, for hazard identification, for causal inference, the so-called Surgeon General's criteria. So this is, I think, an early example of putting information together with powerful conclusions. Interestingly, there's actually a meta-analysis within the report. Here is a summary table showing pooling of the results of 7 cohort studies. William Cochran was a member of the committee, and I suspect that this was his work. But down here, an increase in mortality of 70% comparing smokers to never smokers. In 2014, the year we produced the 50th anniversary report, a very nice redo of that table as a forest plot showing exactly what had been done. So 1964, critical for policy, a systematic review, and a synthesis, a summary of evidence equivalent to a meta-analysis. Just another landmark in this sequence, the 1992 EPA risk assessment of secondhand smoke. This document led to secondhand smoke being declared a Group A carcinogen. It brought together the results of 31 studies, systematically identified and pooled. It was the subject of massive criticism and review by the tobacco industry. There was a federal court decision around its methods, and the policy implications were key. A regulatory agency declaring a ubiquitous environmental agent, secondhand smoke, a carcinogen. Just to show you the scope of the attack, here is a set of papers published, some by, at the time, well-known biostatisticians, on why meta-analysis could not be used to bring together evidence from studies of secondhand smoke. These were in large part sponsored by the tobacco industry or its surrogates. And again, with important environmental agents, very often systematic review and meta-analysis are critical in understanding what we know. Very often we see what I call dueling meta-analysis, one often done perhaps by an academic or federal agency, and another done by a contractor, sometimes reaching quite different conclusions. So let's look forward, and I'm just going to talk to you about some recent happenings in the regulatory and environmental world. As a starting point, one critical document for decision-making is the so-called Red Book, a 1983 report from the National Research Council on risk assessment, which had become a widely used tool for decision-making, but was being done quite differently with different terminology across the federal government. And this report summarized the 4 critical steps. Hazard identification. Does an agent cause an adverse effect, typically supported by a review of the evidence and an evaluation? How does risk vary with exposure or dose? What is the profiling of exposure across the population? And then bringing this together in a risk characterization step, perhaps much like a burden estimate would be done by the Global Burden of Disease Project. So looking at this, systematic review is now often in play across these steps, and particularly for hazard identification. This is a layout of risk assessment and the steps in looking at the risks of an agent. Down here, what is the agent? What are its properties? How does it move in the environment, within people? Who was exposed? How much are they exposed to? And what determines exposure? And then up here, understanding what the questions are, sort of equivalent to the PICO process, but in the environmental world, often referred to as PECO, and then steps related to systematic review. One challenge here is that there are multiple types of evidence that are relevant in the end to the risk assessment, some related to hazard and potential multiple outcomes, some related to exposure of course, and other characteristics of the agent. So moving then to a little bit of history, I'm going to talk about what has happened within the Environmental Protection Agency as it looks at the risks of chemicals. This is a bit of a long story dating back into the 80s to the Integrated Risk Information System program, a major initiative within our Environmental Protection Agency to look at the risks of chemicals. So the IRIS program started in 1984, continues its reports which describe whether there's a hazard and how that hazard risk varies with exposure or dose, widely used within the government and elsewhere. So the story I'm going to tell you begins with formaldehyde, one of the most heavily used chemicals in the world, and a report from a committee that I chaired in 2011 on the IRIS assessment of formaldehyde. And I'll come to that and say a little bit more about that report and its findings, which have had substantial impact on the use of systematic review across the agency. So having looked at what IRIS was doing in this 2011 report, the National Academies were then asked to review how the IRIS program had changed. And the report was published in 2014 on these changes that set out a guide as to how IRIS might approach using systematic review. Again, I chaired this committee, and Lisa was a member with me. And then another problem that I'm going to talk about around risk assessment is the rise of new lines of information that need to be pulled together along with toxicology, epidemiology. We now have large amounts of mechanistic information being generated by new high-throughput assay systems. And then finally, in 2018, I was invited back to chair yet another committee looking at how much progress had been made with the IRIS program. So a long story, but much of it about systematic review. Now, if you step back, this is just the results of findings of a crude PubMed search on articles related to risk, systematic reviews, and meta-analyses. Like many things that we look at in the literature, the numbers are going up quickly and numbering into the thousands. In toxicology, a similar rise, but albeit at a much lower scale. And there's a struggle now to look at what are the best ways to bring together information from toxicological studies. So back to that original 2011 report, the committee I chaired found that, in fact, we were not doing a good job in bringing together evidence in a systematic and transparent way. And in a concluding chapter, gave a roadmap for revision to the processes being used by IRIS, essentially calling for the use of systematic review. And over this span of 10 years now, if you look across the Environmental Protection Agency, systematic review is entering into many processes. I went through this sequence of reports looking at how the agency was doing with bringing in systematic review. Within the IRIS process, as documented in the 2014 report, systematic review has a central place involving multiple streams of evidence, human, animal, and mechanistic. And Lisa is now chairing a committee, looking at how, in fact, EPA is, what protocols it is following. So it's sort of finishing out this saga. I just finished chairing yet another committee, this one on how EPA is using systematic review as it fulfills its obligations under the 2016 revisions of the Toxic Substances Control Act. Our report is out this morning. Here is where to find it. I would just say that the words systematic review are coming into play in complicated ways. So here is out of the rule that the agency is required to follow. And you can see that weight of the scientific evidence means a scientific review method applied and so on. And for those of you who do systematic reviews, you may be puzzled by this definition and its implications. I show it to you to show the codification of systematic review and some of the challenges of moving forward. So just to finish out, we face multiple new challenges. Let's see, I want to have that up. The IARC preamble revised in 2019 looked at how to bring together evidence from humans, experimental animals, and mechanistic evidence. I mentioned the new challenge of these high throughput testing and how systematic reviews may be extended to domains where it's not been traditionally used. So I will note that this is going on. So some bottom lines out of this then, systematic review is being used increasingly in different sectors with various evidence streams. In fact, in TSCA, they're applying it to exposure and pharmacokinetics. Now figuring directly in regulatory issues, the agencies are codifying their procedures, developing new methods and implementing them, and there is much more to come. So thank you very much for the opportunity to participate in this symposium. I'm going to be watching over the next few days, and a valuable resource is going to be built from these recordings. So thank you very much.